Hi, I'm Emily Haynes, Director of Public Health Initiatives at the Partnership for Maternal and Child Health of Northern New Jersey. Thank you for joining us as we discuss the New Jersey Healthcare Quality Institute's Maternity Action Plan. The plan, which complements the Nurture New Jersey Strategic Plan, outlines 4 key areas for improvement that can help improve maternal health outcomes. Today, we are discussing the final section, improving community social supports. The Maternity Action Plan recommends increasing access to affordable housing, maximizing financial support for high-quality healthcare, and enhancing awareness of Connecting NJ and other health programs that support families in the community. For our discussion today, we're going to highlight 2 evidence-based programs that provide community maternal home visitation services. I'm joined today by Jorge Montañez Murillo from YCS Youth Consultation Service and Kate McNamara from Project Self-Sufficiency. Kate, could you please start by introducing yourself for our viewers?
Sure. So I'm Kate from PSS. Project Self-Sufficiency is located in Newton, New Jersey, so up in Sussex County, and we serve families and individuals throughout Sussex, Morris, Hunterdon, and Warren with all the services they need to reach personal and economic self-sufficiency for themselves and their families.
Thank you, Kate. Jorge, could you please introduce yourself?
Yes, thank you. So my name is Jorge, and I work at a Youth Consultation Service. We are a statewide nonprofit social service agency that provides mental health services and community-based programs for families prenatally through age 21.
Great, thank you. So the Nurse Family Partnership, Parents as Teachers, and Healthy Families America are all programs for maternal home visitation programs. Can you provide an overview of your program and how it works? Kate, could you give us an overview of the programs that you have at Project Self-Sufficiency?
Sure. So PSS provides home visitation, which is a one-on-one relationship with a family that is low income and has some needs. And so to do that, we have the 3 New Jersey home visitation programs: Nurse Family Partnership, Healthy Families America, and Parents as Teachers. I'm here to talk about Parents as Teachers in particular. So in that program, parents with a child either prenatally or up to age 3 can enroll to have a home visitor, which we call a parent educator in the PAT world. And so Parents as Teachers involves a home visitation. So there's a component of, these personal meetings based on your child's age and developmental level that happen in your home, group connections that happen once a month. And here we call that a mommy party. And so we have all of the participants in our home visitation programs come on campus to learn, have fun, meet each other, and build those connections. A resource network, which includes working with our partner agencies like the Partnership and YCS to connect them to other services that might not be available right here on campus, and child screening. So a rigorous curriculum of screenings that the parent educator can either do or connect the family to. So developmental, social, emotional, hearing, vision, health. And so we surround these families with support. We allow them to, they are encouraged to make connections with each other. And we develop a relationship that can continue until the child's 5th birthday to help them overcome some obstacles, provide that support, and improve their outcomes for themselves and their children.
Thank you, Kate. It's so important to have that support for parents under the best of circumstances. We all know that parenting is challenging, and adding in other factors of toxic stress and low income, it really does highlight the importance of having that social support network for the family. Thank you, Kate. Jorge, could you please provide an overview of the services that you provide at YCS?
Sure. So at YCS, we also offer 2 home visitation models. One is like the one that Kate was explaining, which is Parents as Teachers, but also Nurse Family Partnership. And Nurse Family Partnership is very similar to Parents as Teachers in the age range and type of families that we serve. So it is prenatal. only up to age 2, and it's specifically for first-time caregivers that can enroll before before the 28th week of pregnancy. And it's typically for economically challenged families where we can support them in accessing consistent prenatal care and having a healthier birth outcome, and also caring for these caregivers' mental health needs postpartum and doing early screenings for their babies. So as far as the 3 home visitation programs are very similar in helping to build caregiver resiliency, develop and strengthen community and social supports, increasing parenting knowledge and child development knowledge, connecting to concrete services, and helping caregivers understand their children's social emotional competencies.
These programs are covering so many topics and offering so much to the families that participate. And I don't know if everyone in New Jersey realizes that they're available throughout the state to all families. I know, for us at the partnership, we have the 3 models as well: Nurse Family Partnership, Parents as Teachers, and Healthy Families America. And really in every county in New Jersey, these home visitation models are available for families that want to participate. So I think that it's a really important message to get out today, is just an awareness. And a part of the maternity action plan is highlighting and elevating these models to reach more families, because we know that they make a difference. So both of these programs begin during pregnancy and extend into early childhood, like you both mentioned, at different ages. So how do those services that are provided by the nurses, the parent educators, and the family support workers, how do those evolve over time? Kate, could you give an example of what the services look like at different points?
Sure. Because Parents as Teachers has a really detailed, evidence-based, research-backed curriculum, there are activities and education that can happen, at each month of the child's development. So what the activities are going to evolve with the child. But also, since it's a personal relationship with the parent educator, it's so individually tailored. So whatever the need is, and the needs can fluctuate. So the families are dealing with lots of stressors. And at one time, transportation may be a stressor, and then that it may not be. Or there may not be a disability or a mental illness or a substance use disorder, and then there may be. So as those things change with the family, the parent educator is there to meet them where they are and help walk with them to where they want to go.
That's a great way to put it, Kate. Jorge, anything to add about how these services evolve over the course of enrollment in the program?
Yes, I'd like to say that very similarly to Kate, with Parents as Teachers and Nurse Family Partnership has some structured visitation with the caregivers, but over time they can make that a bit more customized. So the families can choose how often and in what ways they can connect with their nurse home visitor. With NFP, even before the pandemic, they had already started using video-based home visiting. So with some families, if that was a better option, they could do that. And then as far as the relationships with their home visitors, oftentimes nurses will share that as they work with families, especially after the birth of their baby, caregivers will reach a point where they're trusting in their relationship to reveal very specific needs or very specific goals or intimate goals that they didn't feel comfortable sharing with anyone else. And those things are like buying a home, starting a business, going back to school, or maybe getting a driver's license, or starting therapy, or getting therapy for one of their children. So these are things that maybe at the beginning, some of the families don't express too much, but as the relationship with their home visitors grow and their nurse home visitors grow, these are things that they entrust us with, that we can support them.
Right, that trusting relationship is so important for a family to have, and maybe they don't feel that with their pediatrician or their immediate primary care provider, but they have that support to talk through and help advocate for them and and help them learn how to advocate for themselves, to get better health care for themselves and their children. So I think just really that relationship that's formed is the key, and the flexibility that it's really about wherever, like you said, Kate, meeting the family where they are and walking with them so that they have that person that's like their cheerleader, that's, you know, there with them through the ups and downs of parent, you know, becoming a parent and on that journey. So how do we know that these programs work? Is there evidence that shows that they make a difference? And what is their impact on maternal health outcomes? Jorge, could you talk about how we know that these programs help to improve maternal health?
Yeah, so actually with McVie legislation, and McVie stands for the Maternal, Infant, Early Childhood Home Visitation. I hope I'm getting that correctly.
Yes.
Part of that was also to implement a study for the effects of evidence-based home visiting at the beginning of the implementation of these programs. I believe that's through the Department of Health and Human Services and in conjunction with some other partners like Johns Hopkins University. And they found that there were increases that meant positive outcomes, and also decreases in certain things, which also meant positive outcomes. So some of the increases were increases in caregivers that received some type of educational or job training, improvement of the home environment as it promotes development, early childhood development, increased parental support for the caregivers, and increased parental supportiveness, an increase in health insurance coverage for children, an increase in child well visits, and those were specific to Medicaid paid child well visits, increases in children's receptive language skills, and then also decreases in experience of violence in the home, reductions in psychological aggression in the home, reductions in ER visits for children for accidents, for accidental ingestions and other injuries, and also reduction in behavior problems for children in the home. So there is a lot of positive outcomes that are associated with families involved in home visitation.
Thank you, Jorge. Such a critical time to have all of that really important impact in the lives of the family and long term too. Kate, anything to add around maternal health outcomes and how these programs positively impact maternal health?
Sure. The 3 home visitation models are national models that have been studied for a long time, proven to be effective, proven to be replicable in different communities. And New Jersey has really taken advantage of that and has these home visitation models in every single county in our state. And as you said earlier, Emily, like early childhood parenting is difficult in the best of times. And when you add a disability or no high school diploma or a family of recent immigrants, these are all things that can really amplify those stressors. And when we can provide that support to mom to help her raise her family in the way that she wants to, in the healthiest way possible, that impact on her is incredible. And I know we all either provide or work with places who provide all of those wraparound supports, because while the early childhood period feels like it lasts forever, it doesn't. And so we want mom to have connections, to have careering skills, to really be a part of their community in the way that they want to be after. So helping mom work towards self-sufficiency while she's raising a healthy family is a really important piece of our Parents as Teachers program. Absolutely.
And it's not just about how, their physical health, and that we see, reduced hypertensive disorders during pregnancy. I know with the Nurse Family Partnership model, we see decreased tobacco use during pregnancy and substance abuse disorders. But also, those things that impact both mom and baby. So for example, breastfeeding support, if the mom is choosing to breastfeed their child or chest feed their child after birth, having that person that's really dedicated to provide that support helps them reach their goals and connect them with resources when they might not know where to turn. And that has significant health impacts for both mom and baby, for extended breastfeeding. So I think there's just so many times and touch points where, being enrolled in one of these programs and meeting with the family support worker or the nurse home visitor, parent educator, they're there to provide that, provide that connection to other services too.
Absolutely.
So,
That's a part of
yeah,
our
go ahead.
group connections part, our mommy party part is, we do education on each one, and it is a party, and there's pizza and there's toys and there's music. But we may have someone from public health nursing attend to talk about tick-borne illnesses, or to talk about sun safety or water safety, lead, smoking cessation. All of those things are kind of built in all around the program participation in a fun and engaging way, where they're with other moms who are in their same boat.
That's right. And I think we can take away from today that these programs offer a lot of benefits for families, and really that's why they're included in the Maternity Action Plan, is because they have such a profound effect on, the health and wellness and well-being of families in New Jersey. These programs are all available across New Jersey, and families access them through Connecting NJ. So Jorge, could you tell us more about what is Connecting NJ and how do families get connected to it?
Sure. So Connecting NJ is really like a single point in each county where families and individuals can find referrals for OBGYN services, prenatal care providers, other community agencies, connections to finding health insurance. And really it's designed so that it's a one-stop for all these things. Most of these agencies also have community health workers that canvass the county and meet with pediatricians and clinics and schools and preschool centers and other social service agencies to talk about how to access these services, and also to do some short-term case management and referrals to long-term case management, like the home visitation programs. A simple search for Connecting NJ will show you, usually the first hit that you get is Connecting NJ, and you can see in your particular county which agency is specific to you. And when you call, you can have any issue. It can be that you're trying to find work, or it could be that you're trying to find mental health services for your child, or it could be that you're looking for enrichment activities, and maybe they'll connect you to a family success center. So really it helps to know that you can find everything, or you can at least be connected to almost any issue that you have in one place in your county.
That's right. And they're on the county level. So, they're very familiar with the services that are available. Kate, anything to add about Connecting NJ and how families, access these services in your area?
So Project Self-Sufficiency is the home for Connecting NJ in Sussex and Warren County. And we consider ourselves like the Connecting NJ before there was Connecting NJ. Our doors are open. It's the place to call for whatever you need. And, by having a live, friendly person who is knowledgeable about the services answer the phone, lets people know I have a safe place to call with anything. And whether it's, I can't afford backpacks for my kids this year, or I'm concerned that there may be abuse going on somewhere, regardless of the severity of the problem, we have a friendly person answer the phone and take them step by step through the next steps. It's a great way to connect to home visitation and get involved with one of those programs, which, as Jorge said, is like more of a long-term, close relationship. While Connecting NJ can be more light touch, it could also be, the path that people take to get really involved.
That's great. It's a one-stop shop.
Yep.
So, well, we were at time. I think we could have spent a whole hour talking about these programs and their impact in the community, but I want to thank Jorge and Kate so much for joining me today to talk about this. I urge our viewers to read the New Jersey Healthcare Quality Institute's Maternity Action Plan, which you can find on their website and also in the link below, and consider how you can help to advocate for changes necessary to ensure safe births in New Jersey. If you missed any of our live sessions, you can view them across our social media platforms. Thank you so much for joining us today.
Thank you.
Everyone.